That mysterious red mark may not be a bug bite at all. What do you think caused it? We will use a live decision tree: arrangement, location, and behavior over time. These are clues, not a guaranteed diagnosis, because rashes and skin lesions are often blamed on insects. If redness spreads quickly, fever appears, or breathing becomes difficult, seek medical care before identifying anything. Start with the pattern: one mark or several. 3 or more itchy marks, evenly spaced in a line or zigzag on exposed skin noticed after sleeping, are commonly associated with bed bugs. The classic breakfast, lunch, dinner clue. Treat that arrangement as a useful clue, not a fingerprint. Skin reactions vary, and fleas, mosquitoes, or irritation can also create clustered or linear marks. If the bites appeared overnight, inspect mattress seams, box springs, bed frames, and nearby cracks for shed skins, dark spots, or live insects. Confirm the environment before blaming the bed. Now move to the next branch: location. Marks on ankles suggest different suspects than bites on the arms, neck, or waist, and body placement can narrow the search. Flea bites favor the ankles and lower legs, often appearing in tight clusters with a red halo around each mark. The itching can be intense, and the spots may form several small groups rather than one clean line. That pattern makes fleas worth investigating around pets, carpets, bedding, and floors, where adults and immature stages can hide. Location alone cannot prove the source. Skin reactions overlap, and other insects can bite low on the body. Check pets for scratching and inspect floor-level fabrics, but do not treat the bites as a diagnosis. Now follow the trail upward to the waistband, sock line, or another tight clothing edge, where chiggers can create a distinctive itch. That upward trail points to chiggers, especially when itching starts after walking through grass or brush. Their favorite clue is a sharp boundary, a furious band along the sock line, waistband, groin, or another tight clothing edge. Distribution often tells you more than any single mark. Here is the myth to retire: chiggers do not burrow into skin or lay eggs underneath it. The larva attaches at the surface, creates a feeding tube, and draws up broken down tissue. It drops off after feeding, while your immune reaction keeps the itch going. Use location to narrow the suspect, then ask what the mark is doing. Is it intensely itchy, clustered at a clothing boundary, and linked to outdoor vegetation? That pattern makes chiggers a strong possibility. Now consider the mosquito, whose signature is less a wound than a temporary alarm signal. Its bite usually becomes a soft, puffy, itchy wheal, pale or pink, raised and smooth, rather than firm, crusted or filled with pus. On exposed skin, an itchy bump noticed after time outdoors supports that explanation, but it cannot prove it. Many insects create similar reactions. A typical mosquito wheal fades within about a day as the saliva-triggered inflammation settles. Some people react longer or swell dramatically, so duration is a clue, not a stopwatch. But when several bites burn and develop white pustules, change suspects. Fire ants are next. Fire ants sting, and the first clue is often immediate: several sharp, burning sensations in a tight cluster. Over the next several hours, each spot may swell, then develop a small white sterile pustule, often by the next day. That pattern is unusually suggestive of fire ants, especially after standing near a nest or disturbing soil, though the setting and your other symptoms still matter. Do not pop or squeeze the pustules. Opening them creates a route for bacteria, and infection can erase the original pattern that helped identify the culprit. Seek medical help for trouble breathing, widespread swelling, dizziness, or rapidly worsening pain. From here, we move to stinging insects, where that first instant of pain can tell us more than the later mark. A bee sting usually announces itself immediately: a sudden, sharp pain, followed by redness and swelling at the site. If a barb remains embedded in the skin, that points more toward a honeybee whose stinger delivers venom after the bee flies away. Remove it by scraping it out, rather than waiting for the swelling to grow. Still, not every bee leaves a stinger behind, so the mark alone is not proof. A local reaction is common. Rapidly spreading swelling or symptoms across the body require urgent medical attention. A painful sting with no visible stinger points us toward the next suspect: a wasp. A wasp sting usually delivers an immediate sharp jab, followed by redness, tenderness, and swelling that may intensify over the next several hours. Unlike a honeybee, a wasp typically does not leave a stinger behind, and it can sting more than once. But finding no stinger is not a wasp identification test. The stinger may simply be hard to see, or the insect may be another species. Seeing the attacker, or identifying it later from a clear photograph, is stronger evidence. Swelling that appears later also cannot name the culprit. Now consider the famous paired punctures, a clue that demands even more skepticism. An assassin bug can deliver a sharp defensive bite, sometimes leaving 2 close punctures where its mouthparts contacted skin. Pain at the moment of contact makes a witnessed encounter more useful than the mark itself. If you saw the insect, photograph it from a safe distance and ask an expert to identify it. Do not handle it. 2 nearby dots on unobserved skin do not prove an assassin bug. Punctures can come from many causes, including other insects, splinters, scratches, and irritated follicles. Internet photo matching rarely settles the question. Note where and when it happened, and watch for changing symptoms. A tick may leave a tiny mark, but its importance depends on exposure and prompt removal, not bite shape. Ticks are easy to miss because their bite may be painless, and the tick can remain attached in a hidden spot, such as the scalp, waistband, or behind a knee. Look for the tick itself, a small bite site, or a rash that expands over time. A classic bullseye pattern can occur, but it is not required. Fever, headache, unusual fatigue, or other illness after outdoor exposure also deserves attention. If you find a tick, remove it promptly with fine-tipped tweezers, then record when and where you encountered it. Seek medical advice for an expanding rash or fever, especially after exposure in an area where tick-borne illness is common. A bite site can fade before symptoms appear. Next comes the suspect, most often blamed when nobody actually saw an insect. Now, the spider is often blamed when the evidence is weakest. Most isolated red marks called spider bites are not confirmed spider bites at all. They may be hives, skin irritation, an infection, or another insect's bite. A spider bite becomes more convincing when someone saw the spider bite. 2 puncture marks do not prove it, and neither do bruising, swelling, or dramatic internet photographs. Those features can appear in many skin problems. Watch what happens next. Seek medical care if redness spreads, pain worsens, the area becomes hot or drains pus, or you develop fever, breathing trouble, muscle cramps, or increasing swelling. Naming the bug matters less than recognizing a lesion or symptom that needs attention. Here is the safety net. 3 changes should end the guessing. First, after possible tick exposure, get medical evaluation if you develop fever or an expanding rash, especially a bullseye pattern. The bite may have looked ordinary, and the tick may never have been noticed. Second, have a worsening wound examined if it keeps growing, turns black, or develops a thick crust instead of healing. A suspected recluse bite can resemble MRSA or another skin infection, so do not diagnose the cause from a photo. Third, treat symptoms beyond the bite as urgent. Swelling that spreads away from the original spot, trouble breathing, dizziness, or swelling of the face or throat can signal a serious allergic reaction. Call emergency services for breathing trouble, throat swelling, faintness, or rapidly worsening symptoms. If none of these warning signs is present, wash the area, avoid squeezing it, take a clear photo, and monitor its size and symptoms. Uncertainty alone is not a reason to panic. Worsening symptoms are the reason to stop guessing and contact a clinician. Thanks for watching. Use 3 questions. What is the pattern? Where is it located, and how has the mark changed over time? Clues narrow possibilities, but worsening lesions or systemic symptoms matter more than a perfect label. In comments, describe your bite, pattern, location, how long, and I will tell you what it looks like.